not comfortable testing using the old method or the old.
Daktari atakwambia hapa my dear. Daktari atakwambia wazi bwana kama it was uncomfortable. It was just uncomfortable. I mean the whole, just hearing it. Ni kusikia tu wacha kwenda, kusikia tu like hapana bana. Kama ni hivyo acha ikae bana. Kama ni hivyo acha ikae bana. Hapana. I didn't want that to happen to me. I didn't want that to happen to me at all. It has never happened. Unbeaten haijawahi kuvunjwa. So hapana bwana.
Which method?
Hapana bwana, hapana.
So
amekataa.
Yeah, so well the way it was tested before is by a rectal exam, it's called digital rectal exam, where a finger is put into the anus and then the doctor can actually feel if the prostate is enlarged. And also by that examination can feel if it looks, there's what is called benign enlargement, which is not cancerous, and then there's the cancerous enlargement, which they can feel by just that examination. And as he said, yes, it's a lot of people who are quite uncomfortable with that. But now there's a blood test, which can be done every 2 years or so, from about the age of 40. And that trend of the results can be followed, so that if it rises one time, then at least the doctor can do other tests to see if there's signs of prostate cancer.
Right. Dr. Julius, have you had this training yet?
I think I'm like him. I have never had, when you sit with a doctor and they tell you what they're going to do, you're like, you feel like something that is not you. And it's not only scaring, but I think you feel like you're not ready for it. But I'm so glad that there's this test. Now you can be able to go and do that. And of course, second is that there's always a fear. With most of, sometimes we don't express our fears. You're like, what if I go and find I have it? What do I do? Okay. And of course, the best thing is the doctor says the earlier the better to be discovered, because treatment is available, than finding it later. And also there is also that aspect of not understanding. When people hear prostate, they don't even understand what prostate is. I think there is a lot of information that needs to be divulged so people can know where the prostate is exactly and how it is, so that they are not afraid. Because some men, you tell them prostate, they think it is the entire system there that is maybe have a problem. So they always...
And actually, Dr. Sang, do you want to answer that right now?
Yeah. Actually, he's raised a very important point we get with clients saying, I'd rather not know. If it's there, I'd rather not know that it's there. So we need to encourage clients to come and be tested, because in the majority, it's not there. And so, especially when you start at 40, for example, you can pick it very early. But the other point was...
some not knowing where it is.
Oh, yes,
located.
exactly. So education. Education is extremely important. What is the prostate? What does it do?
So what is it? And
well, it's a gland, and it's within the reproductive system of the male. And so the urethra, where the urine comes out, and also where the sperms come out, it goes through the prostate. And the prostate produces some liquid which is included in the semen. So the semen has sperms and other solutions which combine to form part of the semen. And so if it's again not working properly, then there'll be issues with fertility. But now the problem is as a man gets older, some of them have enlargement of the prostate, so that some of them have problems passing urine, and that at times needs surgery. But the problem now is that some of them now develop cancer, and that's a cancer which can spread and, of course, cause death.
All right, and we shall get to talk more about prostate cancer, but let's move on. So the